Is anything sounding familiar as we get deeper into this series on triglycerides? Where have you heard triglycerides before recently? Remnant cholesterol. Remnant cholesterol. Where have you heard that? Well, there's a fellow named Dave Feldman who's making a lot of waves on YouTube and some other places talking about lean mass hyperresponders and remnant cholesterol. If you go to the Standard of Medicine, Journal of American College of Cardiology, for example, recently in February 2019, published an article, Triglycerides, Remnant Cholesterol, and Atherosclerotic Cardiovascular Disease. It's a great article for drawing in some of the current research, some of the things that they're looking at in the standards of medicine, and again, continuing to maybe ignore a lot of the focus that's really hot right now, fortunately, prevention and controlling this through diet. And as you may know from me mentioning David Feldman, he's all over low carb diet, low carb down under. So this is all about keto diets. Here's the thing, as you go on a keto diet or drop the carbs in your diet, you tend to decrease the triglycerides in your bloodstream. You've heard me talk about it in a different space multiple times before, the triglyceride over HDL ratio. Remember what we talked about in terms of mechanisms? Insulin, of course, decreases blood sugar by opening up channels that become resistant in our muscle cells and our liver cells as we get older, insulin resistance. But most people don't know that insulin also decreases fat burning. So that's where you get this statement that you hear in a lot of books that have been around for a few years, like why we get fat and what to do about it. This whole concept of it's not that we're getting fat because we're eating more, it's that we're eating more as we go into middle age because we're getting fat. And why are we getting fat? Because we're getting insulin resistant. In other words, our insulin values are just creeping up and up and up. Basal insulin values, so we're stopping the fat burning mechanism. What does that do in our bloodstream? Our triglycerides go up. Well, there's a number for triglycerides, but there's also some numbers that reflect triglycerides in the cholesterol values as well. Besides triglyceride itself, they're called VLDLs and IDLs. VLDL stands for very low density lipoprotein. IDL stands for intermediate density lipoprotein. And chylomicrons. Chylomicrons are actually the lipoproteins carrying triglycerides from food. VLDLs are what the liver makes full of triglyceride, and it's sort of a counterpart to chylomicrons. So I hope that starts to connect some of the dots that you may have been hearing in multiple times, multiple different ways about insulin resistance, high triglyceride over HDL ratio, remnant cholesterol, David Feldman, and then the recent research going into triglycerides, remnant cholesterol, increased risk associated with heart attack and stroke. Again, this was just a short one to try to connect some dots for you. I'll continue on in the series. Thank you. If plaque is the #1 cause of heart attack, stroke, dementia, blindness, kidney disease, you'd think we'd know how to evaluate it, screen for it, wouldn't you? Unfortunately, the state of the art right now is a guess, and a bad one at that, Framingham. The most common thing that you do is you say, well, hey doc, why don't we do a stress test? They don't work either. Then you go into the cath lab and get a definitive test, but that involves getting a needle in the groin. It just goes downhill from there. Now, there are better ways. Take a look at our plaque evaluation course.